Well, cervical cancer is preventable and it can be treated. January is Cervical Cancer Awareness Month. It's a really important time to discuss just how vital screening is. And joining us today is Dr. Amanda Ramos. She is a gynecologic oncologist at Hartford Healthcare Cancer Institute. Thank you so much for being with us, Doctor.
Thank you for having me.
So when are women most at risk for cervical cancer?
That's a great question. So women can be at risk at any age, but we do tend to see the more frequent cases between the ages of 30 and 50, but anyone could develop it at any time in their lives.
So what are the signs and symptoms? Are there any that women should be aware of?
Yeah, so abnormal bleeding from the vagina is one of the most common symptoms that women experience when they have cervical cancer. That, along with pelvic pain, a lot of women will experience pelvic pressure, frequent urination. But I would say abnormal bleeding, like bleeding between periods or postmenopausal bleeding, are the most common symptoms.
What are the most effective ways to reduce your risk of cervical cancer?
So definitely going to the gynecologist once a year to have an annual pelvic examination so that we can take a look inside the vagina, look at the cervix, make sure it looks normal. Doing that once a year, and then having a pap smear, which is a test of the cervical cells. That's done every 3 to 5 years. And if there are any abnormalities, we do that more frequently.
And what can women expect when it comes to that cervical cancer screening?
Typically, we will do a very gentle and quick pelvic exam. So we put a speculum inside, take a really good look at the cervix. We use a little brush to get some cells from the cervix, and then that goes off to our pathologist who will look under the microscope and see if there's anything abnormal. We also look for HPV, which is the virus that can cause cervical cancer about 98% of the time.
All right, so there's some important tips out there. If you haven't gotten your screening yet, make sure you make your appointments. Dr. Ramos, thank you so much. And for more information, just go to hartfordhealthcare.org/cancer.